Okay, we are looking at the anatomy of the lumbosacral junction, and we are looking at the cut surface. Sagittal cut has been taken. As you can see, these are the great vessels, and we are looking at the vertebral body of L4. We are looking at the vertebral body of L5 and the sacrum. You can see very clearly this is the disc L4-5. This is the disc L5-S1. This is the inferior pedicle, inferior facet of L4, and this is the superior facet of L5. They form a joint here, and you can see the joint space very clearly. Now we would like to tell you that this is the nerve which is going below the pedicle, outside the foramen, like this. This is the nerve, this is the pedicle. You will find that in this foramen, this is the nerve, this is the disc, this is the posterioannulus, but this is a very important structure which attaches between the superior articular process and the inferior articular process. This is the ligament. Now this ligament has to be removed if we have to de-roof the root canal. This ligament, if you see from this side, now you will see that this is the facet joint which is opened out because of dissection, and you will see here that this is the exiting nerve here which is coming out. This nerve coming out below the pedicle. As you can see, my needle is showing you the path of the nerve. It is joining the nerve from above to form the lumbar plexus. And you will find that when we land in the endoscopy, we land here. We land below the inferior facet, or we land below the isthmus, and we come here. Now our duty when we are doing the endoscopy would be to land here, because we will be coming inside the disc anyway, below this ligament here, and what you see above the needle will have to be removed. What you see above the needle,
Dorsal.
yeah, this ligament, the yellow thing which you show the ligament. That's the ligament. That is very important, and somehow this is not appreciated in the normal dissections, because we do all dissections from dorsal aspect and we invariably remove that ligament, so we never know that this is forming the roof of the canal. Yeah, the needle is at the level of the disc. As you can see, the needle, you see the nerve, and you see the ligament which is attaching to the superior articular process to the inferior articular process.
So in lumbar canal stenosis, it is of utmost importance to remove this part of the ligament.
Absolutely.
To take away the symptoms
to de-roof the
of
canal.
the claudication responsible
Yes,
of the exiting root.
Now there is one more thing which we would like to show you. If you come through the facet, if you have access through the facet, as we call it, transfacet, you put it in the foramen. In the foramen. Now this is in the foramen. You can see the knob which is just below the nerve, and this is transfacet access. Now my instrument which is coming through the facet joint is hitting the ligament directly, and this other instrument with the knob is protecting the nerve which is here below the pedicle here. So we can remove this ligament by going through the facet like this. So a transfacet excision of this ligament is possible if somebody wants to do it from posterior aspect. This is a facet joint. You can go like this here.
So this is the posterior view of the same thing.
That is a posterolateral view. This was a posteromedial view or medial view, and we have a sagittal cut. And here you can see again you can see here, this is L5, L4, and this is the sacrum, L5-S1 disc. Now here, for example, in the L5-S1 foramen, you will clearly see this is the pedicle of L5.
Yes.
This is the inferior facet of L5. This is the nerve, which is the L5 root, which is going. You can see beautifully. You can see just below the pedicle it is going out. You see this is the lower surface of the pedicle. This is the nerve. Now this is the disc. This disc is coming out in the foramen. This is the superior facet of S1, and you can see very clearly this is the ligament which we must remove. Now we are not in the midline, we are far away laterally, so this can only be accessed through the foramen and not from posterior midline. This is the ligament. You can put the knob like thing. See, I am putting my knob like thing in the foramen, where the nerve is supposed to be
Under the pedicle.
under the pedicle, and you can see it coming out where we have not dissected as yet, but we'll see.